Okay, so it's Wednesday the 8th, and I have a patient here from Boston, or a suburb of Boston. She's 39 years old. This is the first time that I've seen her, and she actually contacted us because she wanted to do her interview on on video, so she could tell her story, and people would hopefully relate and see that they're not alone, and that they're not the only people that are the only patients that are dismissed. And so we're going to start off. As I said, she's 39. And so when do you remember starting to have problems with your bladder?
2014 was the first time on record that I went for a urine culture.
Tell me what was going on in 14 that made you seek treatment.
Burning bladder. I remember when I would go pee, it felt like somebody dropped a brick at the end of my bladder.
Did it come on all of a sudden?
I think so.
We're talking to 8 years ago now.
Yeah,
so
exactly.
It's been a long time. So
Yeah.
you had this onset of pain in your bladder. Had you had trouble with your bladder ever before?
Before that, no.
So you hadn't had a history of you're 30 years old at that time. You hadn't had a history of recurrent infections or anything like that, right?
No.
Okay. And so what happened next?
So I had to look back in my my chart to see, but it looks like every single year from then I was seen either once or twice a year for a urine culture to be done.
Okay, so you look back in your history and you saw that you were getting a culture done once or twice a year, but during that time that you say you weren't getting a culture, were you having symptoms? Did your symptoms go completely away?
They did then.
They did?
Yeah.
So you would have an infection.
Yeah.
You would go get treated,
Mm-hmm.
and your symptoms would resolve.
Yes. Until 2020 is when it got really, really bad.
What month about?
It was in the summer.
The summer of 2020.
Yeah.
So we'll say about 7 of 2020. What happened summer of 2020?
I was having a snack party on the couch with my daughter. We were watching movies, eating candy and junk. And the next day I woke up and my bladder was on fire.
Mm-hmm.
And I had urgency and all that. And I went to the doctor. They prescribed me an antibiotic over the phone just based on my symptoms.
So you just called in. Hey, I'm miserable.
Yep. And they did a urine. I went in for a urine.
So you saw the doctor.
Yep.
Okay. And so.
Well, I might have been camping and then I went after. But they called me in the macro bed and then I went in for a culture and it came back negative.
Okay, so in July you had a negative culture.
Yeah.
You got macrobid.
Yeah.
Did you have any response to macrobid?
It made it worse. It
So you
seemed to
got
make
worse
my
with
bladder
macrobid.
angry, so I just stopped taking it.
Okay, well that's probably what I would do too.
Yeah.
So you got worse with macrobid.
Yeah.
And so what happened next?
So I started taking aloe pills, drinking water. I saw a urologist. They told me I had overactive bladder syndrome. They prescribed the oxybutynin. I forgot to tell you.
This was in 2020
Yeah.
still. So you
Yeah.
had oxybutynin in 2020.
Yeah.
And did that help any?
It kind of relaxed my bladder, but it didn't get rid of the problem.
So it helped with your frequency and
Yes.
urgency.
Yes.
Did it make your mouth dry?
Yes.
Did it cause any other side effects?
No, but I learned later that it's one of those medications that can cause dementia if you take it on over a long period of time.
Yeah, there's a relation there. Any of the anticholinergics,
Yeah.
there's lots of different anticholinergics, and they all have that risk.
Yeah.
All right. So macrobid got worse. Oxybutynin helped with your frequency and urgency. And so how long did you take oxybutynin?
Maybe a month or two. I just drank a ton of water. I changed my diet. They sent me for bladder physical therapy, but it didn't really do anything.
So you got pelvic floor
Yeah.
physical therapy. And how long did you do that?
Like 2. because it didn't really help.
2 months?
No, well, yeah, like
Oh,
two sessions.
2 sessions?
Yeah.
Okay.
It was a pretty high copay for something that wasn't helping.
Yeah. Yeah, gotcha. PT, no response. What happened next?
So my symptoms kind of, like, I thought they went away. So it was on and off in 2020. I was taking the aloe and the oxybutynin, like, intermittently. But it was, like, on and off. And then it seemed to have resolved, and until March of this year when it came back with a vengeance.
So you went from 2020 to March, April of 2022.
Yeah.
And you were pretty good.
Yeah, I thought it was gone.
So you were completely asymptomatic.
Mm-hmm.
You had no frequency, urgency, or pain. You didn't have any trouble with intercourse.
No.
Okay, great. And so let's go to March, April 2022. What happened?
So I'm in school, very stressful. Not drinking that much water in between clinicals and everything. Very minimal water, and I was eating a bunch of trash food and not sleeping very much. And I want to say mid-March, I started having the burning and frequency. I tried to manage it myself. I drank some water, did the aloe pills again. It did not help at all. Okay. On March 17th, I went to my primary care doctor. I did a urine. It came back negative, and this is what I want people to know. So it came back negative. I'm telling them, and at this point it was on the outside of the female bits.
So you have external irritation.
It was my bladder and external. It had like transferred out there after a couple weeks.
Deep in the vagina or just out on the exterior?
On the outside.
Okay.
It was like whatever was in my bladder was irritating the outside.
Uh-huh.
And I told my primary care doctor, and I'm like, this is like serious. I don't know what to do. And they kind of brushed me off. I had asked them if they could do another urine because the first one I had drank soda, and I'm like, well, maybe it was watered down. They refused to do another urine. So I was just trying to manage it myself. I was very uncomfortable. I went on April 1st. I started having like night sweats and like some twinges in my back, kind of where your ureters would be. And I'm like, I hope this isn't what I think it is. And over the next couple weeks, I felt it kind of progress up to my kidneys.
Were you having any fever?
No, just night sweats every single
When
night.
did the night sweats start? That's actually kind of an unusual story.
April 1st.
Wow.
The moment I started having back pain.
So that all happened at the same time.
Yeah.
Night sweats,
Yeah.
back pain. Was there any problem during the day with fever or chills?
Never. No.
All right. And so essentially, are you the same now as you were in April, or things changed some?
So my bladder frequency and pain isn't as bad. It was like almost like when the bacteria went up to the kidneys, it didn't irritate the bladder as much.
It's an interesting story. I've never heard that story before.
I know.
That's very cool.
It does still flare, especially if I don't drink. I mean, I drink a ton of water. I don't know if we have more immune defenses in our bladder. I don't know.
Well, I think that's a good point. I think what she's. I'm going to talk to the people
Okay.
for a second. This is an immune problem. Okay, this is a failure of the immune system to take care of an infection. So it's interesting what she's telling me, because I've never really heard that story before, where there's like an ascending infection in the up into the kidneys. I will say this, that most people that have fever and chills and night sweats, most of the time those people are probably living a kind of a subseptic life, and that, you know, they're borderline getting really sick, can get really sick. So did they do any, when you were having this story, did they do any type of upper tract studies? Like, you know,
Yeah,
I mean,
so
usually when you start having fever, chills, and that kind of stuff, you know, you're concerned about somebody getting really sick.
You would be amazed at the amount of doctors that I have seen and how much I have been brushed off. Like, totally dismissed. And I've read the after notes from each of my visits, and they make me sound like I'm making all this up because my urine cultures are negative. So I dealt with it the whole month of April, and in May I went back, and because the pain was getting worse in my back, and they did an ultrasound, and they found like a nodule and some shadowing and some stuff in my kidneys. They then Sent me for an MRI. They said that there was nothing in my kidneys, and now there's.
So what they saw, they saw what they thought was a solid lesion in your kidney, and so they sent her for an MRI to make sure she didn't have a small kidney cancer, which the MRI did not show a small kidney cancer, and none of those tests are really good at looking for infection unless there's associated obstruction. So go ahead.
Yep, so there's no obstruction or anything, but it's the sheer amount of doctors. I mean, I've seen a nephrologist, 4 different urgent care doctors. The last one I went to see, she's like, oh yeah, you have swollen lymph nodes and, you have night sweats. Maybe drink some more water. And I was like, okay, none of them are trying to get to the bottom of it. And I even asked them if they want to straight calf me to get a urine, and they...
Yeah, I've never really heard a patient say it any better than you just said it. They don't want to get to the bottom of the problem, okay? That's never really been said better about this condition. People are fixated on symptoms. They love to treat symptoms, but they will not dive deeper.
No.
And I'm not sure why that is. I mean, the curiosity of medicine is why, why
there are very few doctors.
Why is this happening? What can we do? What can we do to prevent this from happening? What can we do prevent this from getting worse? And that's the failure of medicine with this condition is let's dig deeper. Let's not treat symptoms. There's a cause. And I go through this all the time. So many of the procedures and so many of the medications that are given to patients with chronic bacterial cystitis are to relieve symptoms.
Yes.
Okay, oxybutynin, what does it do? Well, it decreases bladder contractility, so it will help with frequency and urgency. But no one ever thinks about why is there frequency and urgency? Well, the frequency and urgency is occurring because your bladder muscle is irritated. Okay, well, what's irritating it? Well, there's very few things that irritate the bladder muscle. There's cancer, there's radiation, there's neuromuscular problems, spina bifida, spinal cord injuries. Obviously, you don't have those. So, the most common thing that irritates the bladder muscle is what? Bacteria. So, let's figure out the cause. That's why we're all here.
And then the day before I came here, I had an appointment that I was waiting for to see a specialist at Brigham and Women, which is supposed to be a really good hospital. He's supposed to be top notch. And he told me, good news, everything is perfect. You're perfect. And I said, what about the night sweats? What about this? What about that? And all he said was, I don't know, maybe you need to go back to your PCP. Basically.
PCP?
My PCP that wouldn't even do a second urine.
Didn't want to do a urinalysis. Yeah.
And what's the other side of this that I just want to say is, and then I saw a nephrologist and that was a nightmare too. I want doctors to kind of look at patients like, what if this was my wife or my child or myself? And I actually believed their symptoms. Like this, if you listen to what I'm saying, like it started here. It progressed. I got night sweats, drenching night sweats every single night. Night sweats are a huge indicator that there's a problem, right? I have stabbing pain. Like if you listen to that, and if that was someone you love or yourself, you would be digging to get to the bottom of that. You wouldn't just be brushing me off to the next specialist, And I feel like that's what's the most frustrating about it because it's very dismissive.
Yeah, it is. And
I cry every day about this.
I know. And I'm going to get you better, okay?
I know you are.
I hate to laugh, but I mean I spend most of my day laughing because I don't like to cry. I mean
I cry every day.
I know, and all the patients that are gonna see this interview can relate to you. They've all been dismissed, and I appreciate you spending the time to expose your personal life. It's a very frustrating, it's a very tragic problem to deal with, and as I told you, this is gonna. You have bacteria. You have bacteria living in your bladder lining. They're very happy there, and they've been there for a long time now. They've been there for 8 years now. Several of those years you did fine, but they were there, You guys were living in symbiosis. Okay?
I believe that because it was the food that activated it.
It's a symbiotic relationship between us and bacteria. The bacteria are all over it, in our eyes, in our skin, in our nose, in our mouth, in our GI tract, and your vagina, and my urinary tract. But you get a dysbiosis. Are you familiar with that term? Dysbiosis means there's a difficulty. Dys means difficulty in general. And biosis means living organisms are working together. Symbiosis means they're living in harmony. Dysbiosis means they're living in difficulty. There's a problem. Mm-hmm. And that's the same thing with, you're familiar with bacterial vaginosis. That's a dysbiosis. That's a situation where bacteria that normally live in the vagina have gone awry. And I think a lot of those patients actually have a genetic predisposition to intraepithelial, colonization of the bacteria. I think it's very similar to the chronic bacterial cystitis. And I think you even mentioned it. Your bladder went crazy and your vagina went crazy at the same time. It's a classic case of dysbiosis. This is a bacterial immune, the bacteria and the immune system are no longer living in harmony, right? Mm-hmm. Does that make sense to you now,
yes.
Doesn't it? Yeah. Well, God willing, we're going to work hard to get her better, and we appreciate your time, and, keep the faith. It just takes time. This requires a lot of patience on my part and your part. Okay?